is Danelle Dickson. I've been practicing orthopedics and sports as a physical therapist for just about 6 years. My background is actually as a dancer. I initially got injured when I was dancing in New York, and a physical therapist saw me and miraculously fixed me, and that's when I knew that this is what I wanted to do. Most dancers, consistently don't get paid a lot, don't have a lot of money, and that really inhibits a bit of their access to that care that is applied out there for them. Most people think that injuries resolve a lot quicker than they actually do. The purpose of physical therapy and most of the allied health professions, along with the medical community in general, is to get you faster or more safely from point A to point B. There are times when you would hear of a magical thing like, I went to a doctor and he gave me an injection and it just went away. That's not always the case. The body naturally does not work that way. And depending on your injury, and everyone is very specific, depending on your injury, an injury can take anywhere from 2 days to resolve to a year to resolve. And I think dancers, again, we're impatient. We wanted to get back to the stage yesterday. We want to go, so sometimes it's difficult to really allow dancers to understand the process of, this is an injury, it's going to take a couple of weeks, it may take months, you may have to change your exercise routine, you may have to change your rehearsal routine in order for this to heal correctly, and that's the most difficult thing. But again, it's not just dancers that are impatient, everyone's anxious to get back to their lives. Aesthetics and the history of dance has really been, if you're hurt, you push a little bit more. It's a tough culture to work around just because of the way that the art form and the sport in itself is developed. My thoughts on it is that education is the strongest tool that we have to really change that mindset. And there are certain times when you do need to push through to get to the next level, and there are times when you need to stop. Pain is a body signal that something is going wrong. And I would say mostly 90% of my dancers have a misconception of what that actually is. And the more education that is out there in terms of what that means, is the better that those thought processes are going to change in terms of dancers. So you go to an audition and you get a spot and you're excited and you're auditioning within the company for a lead role. And I'm putting out an example here. And you do a jeté and you feel a strain in your hamstring, and every time you do a grand battement, you feel that strain every time, bam, bam, bam. But you're pushing because you want to get that role. At what point do you say, well, maybe I just need to stretch it out versus I need to stop? And the difference is that when there's pain from soreness, in terms of you did a good workout on your muscles, you just pushed and it is saying, hey, I'm tired, versus I'm injured. Two totally different things. And a lot of dancers don't know the difference between those two things. And that is when I think that dancers really kind of get into that trouble. You get into repetitive strain injury or repetitive tear injury. And if those things are not addressed in the correct time or healed in order for you to move forward, it becomes a chronic situation that could really impede a dancer from getting on to the next level, which is shortening their career.